So we're going to go through and talk about how we make treatment plans and prep for routine exam visits that are coming in. If it's a wellness visit or it's a sick visit. So first thing that we typically do on our appointment scheduler, when you're working with a doctor, you need to plan for your day. So I'm going to go out just a couple of weeks to some that might not have already been preloaded with appointments charges. So for instance, we have a new kitten that's coming in. Looks like the notes here say they plan to do a booster for distemper and rabies and a fecal. So I'm gonna right click on this and hit update from the appointment schedule. When we do that, you can see if they've had any previous reminders. They're gonna be here. Red means it's overdue, yellow means it's coming due, and the black or gray, depending on where you're looking at it, means that it's not due yet. Typically it has at least 6 months before it's coming due. So down here, it says item, you're actually building what would be like a PVL. It's just not actually on the patient's chart yet. It will automatically transfer once they get checked in. So for this kiddo, I can double click, or you can hit F2 if you prefer to use the keys. And you can type what type of exam. So there's varying different kinds, but for a kitten that's coming in, it's wellness, we're gonna just choose an examination. And then we're gonna add these other vaccines. So we need to do an RCP booster. And it says she's 10 weeks old, so this is gonna be listed as the second. We need to do a rabies, which may or may not be done. If she's not 12 weeks at her appointment, we likely will not do that. Now it's important when you search for the rabies that you scroll down and find the feline rabies. It'll be good for 1 year. We do offer Licinum, so you want to add that as well. And we're going to put 30 tablets in there because she's under 50 pounds. So then the last thing they mentioned they want us to check is a fecal. Most commonly, we're sending them to IDEXX. There are times where the doctors may ask you to use a key screen to Antech, so you just want to make sure you verify with them which one. So this estimate is roughly built. We know what we should be asking the owners when they check in, and we even have an estimate of what the cost will be if they choose to do all of this. It's always important when you're talking to them at check-in that you let them know if the doctor changes their mind, or if they find any new developments that may change, but we'll go over it with them. So we're going to go ahead and close out of this. Now to make an estimate just under a patient's chart, maybe you saw them, it was sick, you didn't want to quote anything because there were maybe some variables that you and the doctor had to talk about on exam first, so you have to examine the patient before we make an estimate. So at this point it's going to be like we've done for surgeries and dentals. If you've worked on those, the estimate tab will flash. We're going to hit tab, and we're just going to put maybe sick pet workup and your initials. You always want to make sure you list who made it so they have the person they can ask questions to. The item ID will flash, and again, this is like building a PVL, so you can double click or hit F2. Depending on what you're going to put in here, we do have some sick pet estimates. Again, these show up as a G for group, and when we include these and hit select, this is actually going to populate with everything. We're talking pets that might need to be hospitalized for several days under ICU with IV catheters and fluids. So you can certainly go ahead and add these things. This is adding about what type of radiology review we might want to do. When you're doing these, it never hurts to say yes to everything. Add on the urinalysis, the tick-borne disease testing, because it gives you a really big, kind of base that you can build off of, and you can always go and delete things. So let's put a doctor's initials in here and hit tab. Then as we can go through here, we can kind of evaluate. Does the doctor think, hey, this is a severe case, we need IV fluids? Maybe it's, hey, depending on what the blood work shows, we might. You can always change these to 0 to 1, or by hitting on that, as long as it's blue, you can also hit Control D, and you can take those items off. So let's say we're not going to worry about fluids, but we do want to check some blood work. Sick enough that we want to make sure before they leave what the results are. So most commonly we're going to do a CBC, which is a complete blood cell count with general health chemistry with electrolytes. So those are already selected. We have radiograph with a radiograph review. This is our most basic review. This is typically not what we're using. Now you have the ability to, again, leave this in a range like we've done before. leave it at a low end of 102 and just overwrite the higher cost of even up to 215 if the doctor is not sure if they want it to be priority or stat. Down here, where you see those other items, you can just click on the quantity, Control D on your keys, and then those are going to go away. Back up here, we have injection fees. These are not something that we commonly quote for, but if you feel like there's a patient, you might be doing some different medication injections, it doesn't hurt to go ahead and put like 2 to 3 of these on here, just to kind of, again, give us a buffer. Medications to go home and pain management. We can have a really wide range. I've had patients that have gone home with over $150 of medication, so I think being a little hefty on these is never a bad idea. Nursing care, so if we plan on admitting the patient, again, anything that has an IV catheter for fluids is going to need to have an ICU nursing care. This can be, again, adjusted down. Maybe we don't need ICU, so you can do 48 to 86. Then we have some of these other lab work. Sometimes the doctors want to look at the T4. Sometimes they want to see the pancreas values. Sometimes they want the urinalysis. All of these things can be listed as a 0 to 1 to give the owners those options. Same thing with the 4DX test. So now you have an estimate for the owner that you can provide. They can sign on it even in the room on the pin pad, and you have a range between 517 and 933, and that's including some medications, but we'll be able to be more specific once we have the lab work and the x-rays back.